of benefits from insurance carriers. Typically, if you had a paper electronic remit in front of you, you would click Add New and then begin your data entry on that remit, which can obviously take time and can leave room for small errors if the remit is large and you're trying to get through several pages. The electronic remits option allows the user to set up a connection between the payer, Trizetto, and PrognoCIS. You would contact Trizetto to do this, to request from the payer that they send all of your explanation of benefits directly through the clearinghouse. In turn, Trizetto will download them to PrognoCIS. Once they get downloaded into PrognoCIS, what happens is it's going to automatically tag your insurance carrier, pick out the claim that matches that explanation of benefit, and it's going to manually fill in the allowed amounts, the paid amount, the coinsurance, the copay, and your denials. So it's going to pick, based on what the EOB says, why the claim was denied or why that line item was denied, and it's going to fill it in for you. So it's going to pretty much do a majority of the work for you. All you would have to do is come in here, double check that everything looks good, hit ready to post, and hit save. So if you consider the time that it would take you to manually do the data entry on that versus clicking ready to post and save, it's a significant time difference. Our second slide is paper resolve, which plays into the electronic remits. So most people will ask, what do you do with the electronic explanation of benefits, the explanation of benefits that will not come electronic to you? There's always going to be a few payers along the way that do not offer anything electronic, and they're still going to send you your paper checks and your paper remits. Trizetto has an option for that as well. They have a add-on feature called Paper Resolve that you can get with Trizetto, add it on. Paper Resolve will contact you, and they will put a folder on your desktop. All you would have to do is scan the paper explanation of benefits into your computer, grab the file, and put it in the folder. That's all you have to do. From there, within about 24 hours, Paper Resolve will take that paper remit or the stack of paper remits that you received and will convert them to an electronic remit and download them into PrognoCIS. The same way your electronic remits come in, where it allocates the claim for you, it's going to happen the same exact way, even though it originally came on paper. It also saves a copy of that paper remit and any electronic remit within the claim. So if you get a patient who calls you and they have a question about that claim, you can go back in and actually view the claim from the magnifying glass located here. So if you have questions, you can easily answer them without having to dig through papers or a filing cabinet to find the copy of that. Our third gem is statements using BillFlash. And that feature is two-part. Part of it is PrognoCIS, and part of it is an add-on feature from Trizetto. The portion that you would have to do with PrognoCIS is simply call our tech support, and they will set up a scheduled process here to automatically download all of your statements once a month, twice a month, once a week, however often you want it, and that gets automatically uploaded to Trizetto. Courtney, did you want to go ahead and demo the BillFlash?
Absolutely, if you'll pass me the ball back. All right. So as Kristen mentioned, we do have the statements process, which is embedded through BillFlash. So BillFlash, what is BillFlash? This is our partnered suite of invoicing and payment services. If you are sending your patient statements through PrognoCIS EHR, you will have a client portal through BillFlash to actually access all of your statements that were transmitted from the software for approval, cancellation, reviews, and reporting purposes. So I'm going to actually dive over into a demo here to show you what that will look like. So bear with me here. Okay. So you'll get your own login. So if you're submitting your statements, what they will kind of look like when they go out is, this is an example of our statement. So this is your template, right? So you'll be able to really customize that. You'll be able to see that you're able to add a logo, or if you want to add just your office information. If you want to leave your payment information here, you can, or you can actually remove that. But you do have a description body where you can add any charges, adjustments, or balance information. Okay, so you're going to actually create those through PrognoCIS. Now, the next step again is going to be BillFlash. So I'm going to actually switch back here. Now, when you log in, you're going to go to Send Bills. So Trizetto, we recommend this because we want to make sure that you review all of your files before we actually approve them for print and mail. So you want to make sure that, you know, everything's good to go. Do we need to cancel something? Maybe a patient called in that same day before you were just about to send that file out. You want to go back in and actually cancel it out of your statement file here. So you'll see that you have the review, the approve, and the reject button here. Okay, you can also cancel your approvals, you can cancel your rejections if you ended up selecting that option but you want to go back and change it again. So this is just an extra step again to help eliminate that, and it also helps you kind of edit it before we make that final send out for you. When clients go out to the approve file, a secondary confirmation is requested prior to execution of the request. So just know that when you do actually approve the file, you're going to get that secondary confirmation to let you know everything's good to go, and basically you can't go back from there. We're going to go ahead and send everything out. If you want to cancel your files from processing and go to print that, you'll actually hit approved. Likewise, a client can actually go back to approve the file where originally it was rejected. The only thing to remember is that this feature is only available until 3 p.m. Eastern Standard Time, Monday through Friday. So you'll be able to have access to that if you want to go back. For review purposes, you can sort by column header. So if you click on review, it will take you to another page. And then you are able to search for your patients, delete your patient, change your paper color, add custom messages, and or create a library of messages for future use. So you do have some options here. A couple extra things. I'm going to actually dive into our report system just to kind of show you what that looks like. You also have the ability on your BillFlash login to delete an individual or group of patient statements. So not just an individual, but you can actually delete the entire group. You can change the statement color, as I said earlier, or change any info on that. You can add a group message, and then you can also add, if you want to, individual messages per statement. So just make sure that you save those. And then if you do want to cancel those out, our reporting system is going to be here. So you'll be able to click on your overview or reports to update by app, and then you have your standard reports. So anything on these reports, you'll be able to sort by or archive your previous statement files by patients, and then you can go in there and sort by date or by patient. And if you just want to see, you know, what has gone out, do we send out, you know, multiple statements for that, you'll be able to kind of customize that as well. And I apologize, my login here is sticking a little bit. So just know that you do have that option to actually run those reports from your BillFlash. So this is what it looks like here. You'll have bill delivery, so you'll be able to actually see when were they delivered, or any kicked back from the post office for, you know, invalid address or change of address, what have you. Payment transactions, and you also have payer changes. So you'll be able to really kind of customize that, and then you can kind of move these tabs around too to stay organized. If you want to select all of them and then archive these, all of your new ones that you most recently sent out are going to populate here. So I'm going to go ahead and bring it back to our presentation, and we'll talk about eligibility checks. I'm going to pass the ball back to Kristen.
Thank you, Courtney. Okay, so PrognoCIS and Trizetto, again, have the ability for an office to check eligibility through PrognoCIS. Previously, you would have to call into the insurance carriers and or go to each one of their websites, log into the website, put in the patient's information to verify their benefits. Adding the eligibility feature with Trizetto allows you to now do it all through PrognoCIS. Within PrognoCIS, on a majority of the screens, you'll see this umbrella for the insurance. Within the umbrella, once you turn on the eligibility feature, this check and details box will light up for you. This allows you to hit this box. It takes 5 seconds or less. The details box will come up, and this will now show you the benefits that you just ran. An example of this looks like this. So it will actually show you the patient's information on one tab, benefit information on another. It'll go into active coverage details, coinsurance, copay, deductible, limitations of their coverage. If they're on one of our friendly Obamacare plans and they are in their default payment period, it will tell you that they're in their grace period so that your office knows that they haven't paid their premium. If they give you an insurance card and they actually have another primary payer, it's going to list it up here for you. It will say view primary payer information, and it will tell your office staff that that is not the primary insurance. This is most useful with Medicare patients. A lot of them will just give you their Medicare card and may not realize they turned it over to an HMO or to Blue Cross Blue Shield. This will allow you to see that before the patient ever goes back to see the doctor. This is an expanded screen just on what the coverage would typically look like within PrognoCIS. And the other beauty is it's going to save a history. So say you ran this eligibility on 12/1, on 12/10 you get a denial from the insurance company saying the insurance was terminated. This will save that original eligibility that you ran on 12/1 so you can go back to it, print a copy, and then send an appeal to the insurance company. It's also useful prior to you sending claims to run this, make sure everything looks good. It will reduce your denials. Knowing whether or not that insurance is primary, whether or not they have chiropractic coverage, whether or not you have the name wrong or the date of birth is wrong for the patient, will help you get paid faster. You can also set up what we call batch eligibility. The batch eligibility feature allows you to set up a process that will run all the eligibility for a patient 2 days prior to their appointment, and your staff can then run a report that will tell them who's active, who's not active, who has date of birth mismatches, and who doesn't. So from that one report, they can see everyone on the schedule for that day and easily identify the patients who have problems. The next feature is denial management. So within PrognoCIS, you have an option to view all of your rejected claims from Trizetto and all your denied claims that you receive back from the insurance payer and work them from each one of those screens. This allows you to resolve the payments quicker with the payers, with Trizetto, get your claims turned back out faster. You don't need to contact PrognoCIS for this. You don't need to contact Trizetto for this. You can use these features, and it's all based on the way you post your remits at the end of the day. One second, I am stuck on a screen. Okay. All right, so from within PrognoCIS, under AR follow-up, you have a denied section. And this will list all of the denials that you have received from the payers. Again, because this is all in the way you post the remit, I'm going to go back to the remit that we looked at earlier. If you have electronic remit set up, it's automatically going to do it for you. If you do not have electronic remit set up and you're manually entering a remit, when you receive a denial, you need to make sure that you're marking that it is denied. And then you go into the three little dots and select the denial reason on the claim. Again, with the electronic remits, it's going to pick this for you based on the EOB. If you are manually entering, you have to pick it yourself. This then filters over to your denied claims section, which allows your biller to easily review. You can sort by patients by clicking the patient tab. You can sort by reason by clicking the reason tab. You can sort by status, whether it's a denial for insurance, a provider issue, a coding issue, or just a denial. This allows you to address issues altogether. So if it's a coding issue, you can sort by status and deal with all your coding problems at the same time. If it is an insurance-related issue, you can deal with all of those at the same time. From this screen, you have an action box here. You can click your action box and say what you want to do. So you either want to write it off, charge next responsible, which means it'll charge the next person in line. So if the patient has a secondary and the primary is denied, it's going to charge the secondary. If the patient is the next one that's responsible, it's going to move the balance over to the patient. You can rebill, creating a new claim altogether. If you want to start over and start from scratch, it's going to make a duplicate copy of your claim and put it in the unprocessed claims for you. You can choose to have the claim reopen, but not resent until you go in and fix it. Or you can have the claim resent without even reopening it. If you've already made a change, maybe it was the patient's date of birth that was wrong, and you changed the date of birth in their registration screen and you just need to resend the claim, you would just hit resend. If you happen to talk to the insurance carrier already and they're reprocessing the claim and they agreed to pay, you can just click this box and it'll notate it on the claim for you. So you can go through all of these and make your little comments. And then when you're done working all your denied claims, you just hit process. And the ones that had actions done on them will disappear from your denied list. The ones that have not been worked will remain on your denied list to be worked later. And again, from this screen, you have access to the patient's registration, the insurance box. You can go back into the claim. The little telephone will allow you to call the insurance company. So from within this section, your biller pretty much has access to wherever she would need to go to make those corrections and get them back out. You can also add notes on the claim here. So if you do happen to make a call and you want to notate what happened, you can put your note here and then hit OK. For the claims that are rejected from your clearinghouse or Trizetto, you would go into Claims section, Return Rejected, and this will list any claims that have EDI errors. Examples could be site not allowed to send to payer. The same way you would see them in Trizetto, you will see them here in PrognoCIS, and it allows you to address them here. You can fix the problem, reprocess all the claims at once. Okay, and then our next feature is the auto claim creation within PrognoCIS. There's no additional setup that's required to do this. Everyone has the ability to do auto claim creation. It is a property that just gets switched on. So if you don't currently have the property on, it's easy to just flip it and then you have it. So a provider would do his normal documentation for his visit. He can use templates that will code for him. He can manually code under assessment as usual. Once the provider signs his encounter, that's when the claim is created on the billing side for the biller. This would benefit anyone still using superbills or where the biller is doing data entry to get the charges into the system. So I am going to demo this for you so you know how it works. So if you're on the EMR side and you have a patient on the schedule, from the assessment screen, your provider would put his office visit, his EMN, repaired a laceration, whatever happened here. Make sure your diagnosis code is there. And then you would go down to the encounter close. Right here, there's a create claim box. Once you turn on the property, these two will be coupled. So once you hit mark encounter complete, your create claim box will automatically check as well. Once the provider signs his note, it's going to go ahead and create that claim. So that means my claim was created. So if I go back over to the billing side, your biller would then go under claims unprocessed, and she would have access to all of the claims that the provider closed that day. From here, she can get the claims out. So she would go into her unprocessed, pull up that claim ID for the day. She could double check her eligibility, double check the codes, hit ready to send, and save. Okay, Courtney, you can go ahead and take it back.
Thanks, Kristen. All right, I'm going to go ahead and share my screen. So we have some promotions going on with Trizetto. So I'm going to go ahead and get this up here for you. Sorry about that. Okay, so the Trizetto promotion, we are going to give you, if you're not a current client of Trizetto and or the RCM, we will provide you with 1 month free for new clients on the claims and remit services. So we will provide our contact information. Feel free to reach out to us after that, after the webinar. And then we are providing 1 month free for existing clients on selected products. So, you know, it could be eligibility that you might find would be useful if you're not utilizing it today. Any type of product that will help you minimize your denied claims. So we can always chat about that after the presentation. We have, we want to take some time to go over the questions Q&A. So if anyone wants to chat or send a couple questions through the chat, feel free to, or raise your hand. We'll be able to answer those questions. We have some of our top 3 questions here. The first one is, what's involved in setting up a paper remit? And I can actually answer that on the Trizetto's end. And what that means is, how can we get all of your remits to come back electronically? So you do have to go through implementation. We have a great team that will help you with that to make sure that you don't have any loose paperwork. And we want to make sure when we include that with Paper Resolve, that anything that is coming back loose paperwork, we can actually convert that over into an ANSI format so you can then do posting and view that electronically. For eligibility, do you connect with all payers? That's a great question, and that's something that we can always evaluate on our payer list, which is located on our main website. But we do have over 800 real-time eligibility connections that we can help you out with. It's going to be the majority of your major insurance companies, like your commercials, Aetna, Cigna, Great West, Humana, and then of course all of your government payers have that real-time connection. So this will really help create that one-stop shop where you can check back through PrognoCIS EHR, and so you are able to collect that copay and make sure that that patient is eligible at the time of visit. And then the third question is, how long does it take to set up BillFlash? Kristen, did you want to kind of talk about your experience with BillFlash and Trizetto?
Sure. So obviously first you would want to connect with Gateway or Trizetto, add the BillFlash feature. Once BillFlash is turned on, you will start a task with PrognoCIS support, letting them know you've gone ahead and set up BillFlash. You will not need any extra FTP passwords, any site IDs for BillFlash. All you need is your existing Trizetto information that's already in there. What will happen then is our support will go ahead and set up that scheduled process for you, and then that will allow you to set up test claims to Trizetto to make sure that it's working efficiently. I've seen it take 24 to 48 hours to go ahead and get that set up and get test files over to BillFlash. Once it's set up and you guys are comfortable with what's going over to BillFlash, the scheduled process is already in there and you're ready to start sending statements.
Thank you. And I think we had an audience question, which was how to upload a paper remit to convert to ERA in PrognoCIS. Kristen, did you answer that or wanted to piggyback back on that response?
Sure. So you would contact Trizetto, set up Paper Resolve. Paper Resolve will put a file folder on your desktop similar to our scan folders that we already have. So the same way you would scan a document into the document list to be filed on the patient's chart, you would set up with Paper Resolve. So you would scan your electronic EOBs, drop them in that folder. Paper Resolve will then pick them up and convert them, and it gets uploaded the same way an electronic remit would from Trizetto. So it typically takes 24 hours from the time you pull it into the folder for you to see it in PrognoCIS.
Great, thank you. So if you have any questions, feel free to reach out to any of us after the webinar. Due to time, we're going to go ahead and present our contact information for you here on the screen, so feel free to jot this down, email us, call us by phone. If you have any additional questions in regards to the ERA process, the Paper Resolve, PrognoCIS, EHR, RCM services, feel free to reach out to us. We want to thank you for your time today, and we look forward to hearing from you.
Thanks, Courtney. Thanks, Kristen. What a wonderful webinar, packed full of great information. And we'll look forward to getting the links and follow-up emails out to people for interested follow-up to add on these great services. So thanks for your time and patience in getting the call started again today. And we look forward to visiting with everybody in our next informative webinar. And we'll be sending that information out again soon. Thank you so much.